going to be hosting this talk for you guys today, and I'm a family physician in Scarborough. So thank you for coming. I was actually asked to do this talk by the Muslim Women of Bonn. They're a new sort of up and coming not-for-profit organization. They're doing a lot of great programs related to health, related to education, among other things, bringing people together from all walks of life. So I encourage you to learn more about them and support them. So thank you for coming and joining us. So today I'm going to be talking a little bit about coronavirus. So coronavirus, it's, I think, a very timely topic. It's something that we're in the middle of the second wave. So it's good to start talking about this. And specifically, I'm going to talk about how to prevent it in older individuals in our community, and also some myth and misinformation that's going around about it, especially on Facebook and WhatsApp. So I kind of want to discuss that. Okay, so let's get started. So what is coronavirus? This is a very simple slide, but I think it's a very important slide to talk about. So coronavirus is actually a family of viruses. It's not just one type of virus. So COVID-19 is a subset of that virus family, and it's a type of virus. And the main thing that coronavirus does is that it causes a respiratory illness. So it causes lung damage, right? It attacks your lungs. There are other coronaviruses, दूसरी viruses भी होती हैं इस family में. The common cold, that is also can sometimes be caused by a coronavirus. लेकिन दूसरे viruses भी होते हैं, notably Middle Eastern Respiratory Syndrome. That's quite a dangerous virus that is also similar to COVID-19, and also the SARS virus that you may have heard about. So these are some of the dangerous viruses that are in this family. COVID-19 is one of them, but also there are other viruses in this family that are not as dangerous, like the common cold virus. So what are the symptoms of coronavirus? Okay, so this is a very important slide because the symptoms of coronavirus can be very broad, right? So you can have fever, you can have fatigue, dry cough. So those are the most common major symptoms that people show. But coronavirus, you can also have other symptoms as well, notably lack of sense of smell, aches and pains, runny nose, sometimes even diarrhea. So there's a wide range of different symptoms that can manifest. So it's important to keep this in mind. Now, there's a lot of misinformation about this virus. Okay, so you may have seen on Facebook, on social media, on your WhatsApp messages, people are sending you things about this virus, how to cure the virus, what to take to cure the virus. I wanted to talk a little bit about that because थोड़ा बहुत फायदा होता है इन चीजों में, लेकिन बाज़ दफा misinformation भी होती है. Okay, so people जब टोट के भेजते हैं आपको WhatsApp पे या Facebook पे, आप right away believe नहीं करें. Okay, make sure you do your research or ask your doctor. That's the main sort of thing I want to get across in the presentation today. तो हम थोड़े myths के जो हैं हम discuss करेंगे, और अगर आपके questions हैं, please keep them until the end and we will discuss at the end because this is a bit of an interesting topic. Okay, so the first myth that I have been reading and that people have been sending to me is that children cannot spread COVID, and they don't get they have very mild symptoms, and therefore they're not able to spread coronavirus. This is not true. So बच्चे जो हैं, they can and do spread COVID, and they actually may be major drivers of the pandemic, meaning they actually can spread it very well. So there was one study, and I will link all of the studies that I'm referencing at the end so you can read them, but there was one study where they found that in children that are younger than 5 years old, a lot of the times the viral particles in their nasopharynx, in their nose, they have up to 100 times more than children that are older than 5 and adults that have coronavirus. So children with coronavirus in their nose, they have up to 100 times more, can have up to 100 times more viral particles in their nose than older children. So सोचे अगर कोई बच्चा आपके ऊपर चीखे मार रहा है and they have 10 to 100 times more viral particles in their nose, you have a higher likelihood of getting sick. We call that viral load. So the viral load is higher. If these children sneeze on you, you have a very high chance of getting sick and getting ill from that. So they can cause and spread the virus very, very easily. So be careful when you're around children and wear a mask and social distance, especially if they go to school. And then the second point is that they don't get very they have very mild symptoms. This is also not true. Most children, yes, the vast majority of children will have very mild symptoms. बस बुखार की तरह symptoms होती हैं उनकी. But sometimes there are cases where children, even if they had a very mild illness, otherwise healthy children, up to 2 weeks after, can get something called multi-system inflammatory syndrome, which is when they get almost like a vasculitis, inflammation in their blood vessels. And this can be very dangerous, okay? So try to protect yourselves, try to protect your children. कोशिश करें कि आपको ये virus नहीं हो, okay? Because it can be very dangerous even to children. From RN Chima, when is the vaccine expected? Um, so there's a lot of research that's being done right now. Unfortunately, with a lot of these, fortunately, what they do with a lot of these vaccines is that they have to do clinical trials. Remember, I was mentioning in vitro studies. In vitro studies are studies that they do in the lab, and then in vivo studies are studies that they do in people or in animals. So in vitro studies, they're easy and quick to do, but in vivo studies take a long time because we have to see and make sure that the vaccine is safe for people, that it's not going to cause long-term problems. So that's why it's taking so long. But they're doing a lot of work on it. Our science has gone very advanced. So hopefully they're thinking maybe in the summer or end of 2021. But we'll see what happens.
Thank you.
And then somebody else, so Hina is asking, did we get the flu shot? How important is it for everyone? So very good question. Yes, you need to get the flu shot. Okay, so you don't want to get COVID-19 and then get the flu at the same time. That would be very bad. So we want to avoid that. So definitely go to your doctor, get the flu shot done. In my clinic, we're running out of the flu shots very quickly. So make sure you book an appointment and go, especially if you're above 65, make sure you get that done. And also the pneumovax vaccine, you have to be careful about that too. If you're a little bit older, the pneumovax vaccine is the pneumonia vaccine. Also get that if you haven't gotten that already with your doctor. From Ada Khalid, is flu shot okay for babies 1.5 years old? Yeah, so flu shots can be given to babies 6 months and above. Okay, so it's safe to give. We even give it to pregnant women, right? So please go get the flu shot. Now for children, you have to remember that if it's the first time they're getting the flu shot, make sure they're not allergic to egg because we use egg protein in the flu shot. So if they're able to eat egg, great, go get them a flu shot. If they're not, tell your doctor. And last thing, in children, if they're getting the flu shot for the first time, they need to get another flu shot 4 weeks after the first one, just to improve their immune response. So just be wary of that as well. Okay, thank you everyone for coming. And so again, please support the Muslim Women of Bonn. They're doing a great job. And thank you everyone for showing up today.